Assalamualaikum warahmatullahi wabarakatuh to Madam Aniza. Today, our groups will be presenting our case study on the information management practices at Columbia Asia Hospital. Before we start, I would like to introduce myself and my roommates. My name is Nafatini. Then we have Muhammad Shukri, Muhammad Shafiq Asnawi, Muhammad Izzat Daniel, and Sarah Amani. Columbia Asia Hospital is not a typical mega hospital. It operates on a unique neighborhood hospital model. This means it is designed for efficiency and accessibility, serving the immediate residential communities of Klang and Setia Alam. Despite its mid-sized capacity, it is fully accredited by the Malaysian Society for Quality in Health, or also known as MSQH. It offers 22 comprehensive services ranging from general surgeries to obstetrics. Our study focuses specifically on how the hospital manage the massive flow of patient data generated by these departments to ensure clinical safety.
For this
and
section, I will
operational
explain the
speed.
relationship between Hospital Columbia Asia Klang and the Government of Malaysia. Even though Columbia Asia Hospital Klang is a private hospital, it is still under the supervision of Ministry of Health Malaysia or KKM. This is because private hospitals in Malaysia are regulated under the Private Healthcare Facilities and Services Act, also known as Act 586. This Act clearly explains what a private hospital is and set the rules for how This Act clearly explains what a private hospital is and set the rules for how a hospital must be registered and licensed. More importantly, it ensures that hospitals follow minimum standards, especially when it comes to patient safety, quality of care, and confidentiality of patient information. Under Act 586, hospitals are required to create and keep accurate medical records. These records must be stored securely and patient confidentiality must always be protected. This means the hospital, as the owner of medical records, is fully responsible for making sure the information is safe and not misused. In addition, private hospitals like Columbia Asia Hospital Klang must follow the medical records guidelines issued by the Ministry of Health. Hospital staff are not allowed to release patient medical records without written consent from the patient. This rule helps protect patient rights and privacy. Because of this requirement, Columbia Asia Hospital Klang must manage its information and medical records according to government rules on data protection, patient rights, and professional accountability. Therefore, the hospital is responsible not only to the government but also to the people of Malaysia to ensure that all healthcare services meet
Columbia Asia
legal
Hospital
and
Klang
ethical
offers 22 medical specialties, which are grouped into 4 main categories. The first one, medical or internal medicine specialties, such as cardiology, endocrinology, and gastroenterology. This focus on diagnosis and managing chronic illness and internal body system. The next one, surgical or procedural specialties, such as general surgery, orthopedics, neurosurgery, and obstetrics, and gynecology, which treat both acute and long-term medical conditions. The hospital is also supported by diagnostics and support service like radiology and anesthesiology, which assist in accurate diagnostics and safe medical procedure. And the last one, specialized patient care, such as pediatric, emergency medicine, and dermatology. Sport medicine to ensure comprehensive care for patients of all ages. Columbia Asia Hospital, Klang, offers 12 complete healthcare packages designed to support patients in wellness, diagnosis, and disease prevention. These packages are created to meet the needs of different age groups, medical requirements, and life stages, make healthcare more accessible and convenient. For child and maternal care, the hospital provides baby vaccination and deliver packages to support mothers and children. There are also adult and preventive health packages such as heart screening, wellness packages, and premium male and female screening, which focus on early detection and preventive care. The next one, specialized diagnostics and treatment packages are available, including cataract surgery and scope packages. And the last one, life stage and community packages include HPV vaccination, pre-employment screening, premarital screening, and a year and heart screening mega promotion that available until 31st January 2026. Hospital facilities. Columbia Asia Hospital Klang is equipped with modern facilities to provide comfortable, safe, and patient-centered care. The hospital offers 15 specialties that support patients from emergency situation to recovery. For example, the first one, emergency and critical services include 24-hour emergency care, ambulance service, and cardiac care. The next one, surgical and procedural facilities, such as operating theatres and ambulatory surgical centres. These both support minor and major procedure. The hospital also has strong diagnostic and health monitoring facilities, including clinical laboratories, diagnostics and imaging, and health screening service for accurate diagnosis. For admitted patients, inpatients, and support services are provided such as multidisciplinary wards, nursing unit, physiotherapy, and occupational health service. And last one, comfort and other facilities, including Cafe Columbia. This help improve the overall patient and visitor experience. Columbia Asia Hospital Klang follow a set of core values that guide hospital operation, staff behavior, and patient care. This value is to make sure healthcare is delivered in high quality, ethical, and patient-centered manners. The 6 core values are customer first, excellence, teamwork, integrity, caring, and community. With these 6 values form the foundation of the hospital commitment to deliver trusted and good healthcare to the community and patient they serve.
Next, I will talk about clients' charter. At Columbia Asia Hospital Klang, their pledge to patients is clear. They deliver care that is safe, ethical, and patient-centered. They protect patient rights, ensure confidentiality of medical records, and provide efficient service with effective complaint management. This commitment builds trust, enhance satisfaction, and reflect their professionalism and accountability in every aspect of patient care. Patients' rights. At Columbia Asia Hospital Klang, they are committed to upholding patients' rights. Every patient has the right to be treated as an individual, to receive clear explanation about their condition and treatment options, and to give informed consent before any procedure. Patients also have the right to participate in decisions regarding their care. Respecting this right ensures fairness, transparency, and ethical healthcare practices. When patients are properly informed, they feel more in control of their healthcare journey, reducing fear and uncertainty. This builds confidence, strengthens trust between patients and providers, and ultimately creates a more positive healthcare experience. Quality service commitment. At Columbia Asia Hospital Klang, their commitment to quality service means delivering healthcare with the right expertise, modern medical technologies, and evidence-based practices guided by established clinical standards. They comply with local regulation and meet international accreditation standards to ensure patient safety. Supported by experienced specialists and subspecialists, they provide compassionate care that guarantee accurate diagnosis, effective treatment, and safe healthcare throughout the patient's stay. By upholding strict quality and safety standards, they also reduce medical error, enhance patient outcomes, and build confidence and trust in their healthcare system. Confidentiality of medical record. At Columbia Asia Hospital Klang, they take the confidentiality of medical records very seriously. Patient information is protected both by law and by their ethical responsibility. Records are stored in a secure electronic system, accessible only to authorized healthcare professionals. Dedicated personnel oversee the processing and protection of these records to prevent misuse or unauthorized access. Confidentiality is vital because it preserves patients' privacy and dignity, encouraging patients to share accurate information about their health. This trust leads to more precise diagnosis, effective treatment, and continuous care, ultimately increasing patients' confidence in their hospital service. Waiting time standard. At Columbia Asia Hospital Klang, they are committed to maintaining reasonable waiting time standard across all aspects of patient care, from registration and consultation to diagnostic and emergency services. To improve convenience, they provide an online appointment system that allows patients to schedule visits in advance, helping reduce queues and ensuring smoother patient flow. They understand that long waits can cause stress and discomfort, especially for those in pain or needing urgent care. That's why timely service is their priority, giving patients the right attention at the right time, while respecting their times and needs. Complaint handling. At Columbia Asia Hospital Klang, they provide clear and accessible channels, including their official website for patients to submit complaints, concern, or feedback. Every complaint is handled fairly, professionally, and promptly, ensuring that issues are thoroughly reviewed and resolved in a timely manner. An effective complaint process is vital because it gives patients a voice, shows that their concerns are heard, and promotes transparency and accountability within the hospital. By valuing patients' feedback, they not only address individual grievances but also identify areas for improvement, reinforcing their commitment to upholding the highest standards of care for the community. In summary, Columbia Asia Hospital Klang's client charter strengthens patient confidence, ensures safety, and enhances healthcare quality. The hospital is committed to a patient-centered approach by upholding patients' rights, maintaining high service standards, protecting confidentiality, managing waiting times, and providing effective complaint channels. This pledge improves patient satisfaction and trust by reflecting professionalism and dedication to local healthcare. Ultimately, Columbia Asia Hospital Klang deliver value, respect, and support to patients at every stage of the journey. We move to hospital awards and accreditation. First, Malaysian Society for Quality in Health Accreditation. In 2023, Columbia Asia Hospital Klang achieved accreditation from the Malaysian Society for Quality in Health, the national body that evaluates healthcare organization on patient safety, clinical governance, and service quality. The hospital was also awarded a 4-year accreditation under the 6th edition MSQH standards, reflecting its strong performance and commitment to continuous improvement. This recognition assures patients that the hospital system and practices are independently monitored, reducing risk and improving care outcomes. It reinforces confidence in the safety, reliability, and quality of healthcare services provided. Next award are Parents' Choice Award. In 2025, Columbia Asia Hospital Klang was honored with the Parents' Choice Award for Best Private Hospital in Selangor. Organized by the Parenthood Media Network, the award ceremony held on 26 July 2025 in Kuala Lumpur celebrate over 100 parenting-focused brands, represented by CEO Ms. Shantani Krishnan and Marketing Manager Ms. Lauren Tan. The hospital proudly received the trophy and plaque. This recognition is especially meaningful because it reflects the voice of parents, showing strong public confidence in the hospital's family and community-focused healthcare. It reaffirms Columbia Asia Hospital Klang's commitment to delivering consistent, high-quality, and accessible healthcare services for families in Selangor. Next award are Best Hospital Natural Health Readers' Choice Award. In 2022, Columbia Asia Hospital Klang was recognized as the best hospital in Klang, Selangor at the Natural Health Readers' Choice Award. The ceremony held on 8 March 2023 at Atria Shopping Gallery honor for Columbia Asia Hospital for their achievement across Malaysia. This marked the third consecutive year of recognitions reflecting consistent service quality and patient satisfaction. The award strengthens public confidence in the hospital's dedication to high quality, patient-focused, and accessible healthcare. General Manager Mrs. Wong Wai Moon expressed appreciation, reaffirming the hospital's commitment to its tagline, "Right Here for You," which emphasized being present and responsive to patients' needs since its establishment in 2017. Last, Asia Pacific's Best New Hospital of the Year. In 2019, Columbia Asia Hospital Klang was awarded Asia Pacific Best New Hospital of the Year at the prestigious Asia Pacific Healthcare and Medical Tourism Awards, held at the JW Marriott Kuala Lumpur, organized by Global Health and Travel. These recognitions came in the hospital's third year of operations, highlighting its consistently high standards in delivering quality healthcare and medical services. Receiving the award, General Manager Mrs. Wong Wai Mun reaffirmed the hospital's commitment to providing the best care for patients. Regional awards like these are significant because they benchmark performance against industry peers, assuring patients of service quality and reliability beyond the local level. For the next topic, I will pass to the next presenter.
This slide explains the role of Columbia Asia Hospital Klang in health tourism. So the hospital accepts both local and international patients and provide quality and affordable healthcare that meets international standards. It operates as part of a nationwide private hospital network and accepts patients regardless of nationality. Columbia Asia Hospital Klang is also a panel hospital for various local and international insurance companies and third-party administration, including international health insurance such as International SOS and Cigna. This allows foreign patients to receive treatment under international health plans. In terms of medical tourism, Malaysia is recognized as a leading destination in Southeast Asia due to the high quality private healthcare system, multilingual staff, and competitive medical costs. The Malaysian Healthcare Travel Council actively promotes medical tourism in the country. Although Columbia Asia Hospital Klang is not a dedicated medical tourism hub, it plays a supporting role within Malaysia's medical tourism ecosystem by providing accessible healthcare services to international patients. So for this part, I will explain the mission, vision and objective of the Medical Records Department. So firstly is mission. Mission of the department is to ensure that patient medical records are managed in a timely, accurate and secure manner. This department plays an important role in promoting continuity of care and clinical excellence by maintaining good documenting practice, complying strictly with confidentiality standards and regulations, and support proactive quality patient care and service delivery. So for the vision of the Medical Records Department is to become a reliable custodian of patient health data. This department aims to provide high quality data services that can support clinical operation while maintaining the highest level of data integrity and information security. And last is objective. The objective of the department include ensuring that all discharged patient records are scanned and electronically stored within 48 hours. Requested medical reports should be made available within 14 working days, and medical records must be complete after patient discharge to support continuity of care, and there must be zero incidents of illegal alteration, loss or damage to the client's charter of the Medical Records Department at Columbia Asia Hospital, Klang. So the first service commitment is timely record retrieval. The department ensure that medical records are made available promptly to authorized personnel to support clinical needs and administrative decisions. Next, the second commitment is confidentiality of medical records. All patient records are treated with the highest level of confidentiality in compliance with privacy law and hospital policies to protect patient information. So the third commitment is accurate patient information. So all documentation is complete properly and updated according to preclinical documentation standards to prevent errors in patient responsibility. Firstly is Chief Medical Officer. Chief Medical Officer plays a supervisory role in the Medical Records Department. The Chief Medical Officer oversees departmental functions, policy implementation, and quality assurance activities. Chief Medical Officer ensure compliance with hospital guidelines and national healthcare standards, coordinate with both clinical and administrative departments on record keeping practice, and ensure that clinical documentation by medical practitioner is complete, accurate, and timely. Next is Medical Record Executive. So the Medical Record Executive is responsible for supervising the day-to-day operations of the Medical Records Department. This includes overseeing the creation, maintenance, and filing of medical records. The executive ensures that medical records are scanned and digitized within the required time frame, and is responsible for the preparation and release of medical reports and case summaries. Furthermore, the medical record executive enforces confidentiality and data protection policies, conduct quality control activities and internal audits, and prepare performance reports for management. So in addition, the Chief Medical Officer works closely with the Medical Records Department on audits and corrective action to continuously improve documentation quality. So lastly is Medical Records Assistant. The Medical Record Assistant supports the daily operational tasks of the department. Their responsibility include registering, compiling, and maintaining patient medical records. They ensure efficient filing and retrieval of both physical and electronic medical records, minimize the time required to scan and upload documents into the electronic medical record system, and monitor the movement of file using a tracking system. So they also assist in the release of information process and ensure that records are stored securely to prevent loss, damage, or unauthorized access. So next is facilities and services. The Medical Records Department is divided into several functional areas to support effective record management. So the first area is the medical record storage, which is provide secure storage for physical medical records with regulated access to ensure confidentiality records. So the second area is the file tracking system, which may be manual or digital. The system tracks the movement of medical file, request status, and document release to ensure accountability and efficient retrieval. And the third area is the record counter, which serves as service counter for patient inquiries, medical report requests, and the release of medical information. So lastly is scanning tools are used to digitize medical records. This support the integration of electronic health records and help reduce risks related to physical record
Now,
loss
let's take a
and
look
disaster.
at the daily workflow of the Medical Records Department. So based on our study, the department follows these three cyclical workflow. It begins with receiving patient files from wards or ER immediately after discharge. The staff then performs the checking process to ensure every document, from consent forms to discharge summaries, are checked and signed. Critically, Columbia Asia operates on a hybrid record system. This means while they handle physical paper, their priority is scanning. Their KPI is to ensure all physical records are scanned and digitized and uploaded to the system within 48 hours of discharge. Once scanned, the physical file go into filing for secure storage, ready for retrieving if the patient returns. After a set legal period, records undergo the secure disposing. The MRD does more than just file papers. They provide critical value-added services that keep the hospital legally compliant. First, they handle the ICD-10 coding. Staff verify the clinical diagnosis and convert them into the international code for billing and insurance claims. Second, they manage medical reports. If a patient needs a report for insurance, the department is committed to producing it within 14 working days. They also act as the hospital data hub, compiling statistics like mortality and census report for the Ministry of Health. Crucially, they handle disease notification. If a case of dengue or COVID-19 is detected, the MRD is responsible for legally notifying the state health department. They also maintain the official birth and death register for the National Registry and Security. Given the sensitivity of the data, security is paramount. So how the medical record department protect their data? Physically, the department is located on the basement floor, away from the public traffic. Access is strictly controlled, meaning the department is locked during non-operational hours, like on Sunday and public holidays. And no staff other than the MRD personnel can enter without supervision. They also enforce a strict removal policy, which states that original records should never leave the room unless there is a court order. For safety, we observe there is a fire extinguisher positioned right at the main entrance. Interestingly, their hybrid record system also acts as the disaster recovery measure. If a fire were to destroy the physical file, the electronic medical record (EMR) ensures that the patient's data is not lost. Like other modern hospitals, Columbia also adopts the information technology application. Care21 is the system that supports the operations in the hospitals. Unlike many hospitals that buy off-the-shelf software, Care21 is a custom-built enterprise resource planning, also known as ERP, system developed by Columbia Asia Group. The system is unique because it integrates everything. It connects the clinical data like lab results directly with administrative functions like billing in real time. This seamless integration is what allowed them to maintain the efficient neighborhood hospital speed. Our study found that the hospital's operations is strictly governed by the Malaysian law. Everything they do is aligned with the Private Healthcare Facilities and Service Act 1998 under the Act 586, which mandates the integrity and accessibility of records. They also adhere to the Medical Act 1971 regarding patient confidentiality and the PDPA 2010 to protect personal data. On a daily basis, they follow the Ministry of Health circular, submitting mandatory census like PS 101 for inpatient returns or PS 206 for foreign patients. Finally, we look at internal retention policy. Columbia Asia follows a precise retention schedule. For example, adult records are kept for 7 years, while pediatric records are kept until the child turns 18 and plus another 7 years. To maintain efficiency, they track strict KPIs. For example, scanning must be done within 48 hours. Meanwhile, reporting should be done within 14 days. This disciplined approach ensures that Columbia Asia Hospital Klang remains not just a healthcare provider, but a secure custodian
In
of
conclusion,
patient
the above
information.
case study emphasizes the importance of health information management in the delivery of safe, efficient, and patient-centered care within the context of Columbia Asia Hospital Klang. As a private healthcare organization that operates within the context of a number of strict regulations, the hospital's commitment to the information governance, clinical quality, and patient rights is evident through the development of well-structured policies, the provision of modern facilities, and the integration of a hospital information system. Columbia Asia Hospital Klang is able to efficiently relate its practices with the government regulation and laws, such as the Private Healthcare Facilities and Services Act 1998, the Medical Act 1971, and the Personal Data Protection Act 2010, adhering to the guidelines and regulations set by the Ministry of Health (KKM). Is an indication of the hospital's accountability to the government and the community, ensuring the integrity and accuracy of medical records of the patients are maintained and only accessible to authorized personnel. The variety of services offered by the hospital and the different packages it has to offer show that the hospital is able to cater to the different needs of the community and even international patients. The recognition received by the hospital through the MSQH accreditation and the different awards it has received at the national and regional level also prove the hospital's consistent delivery of quality healthcare services. One of the strengths identified is the medical records department. This department plays an important role in the continuity of care and the accuracy of information. It also ensures that the hospital meets the standards set for information governance. This is achieved through the structured workflow of the department, the observance of confidentiality, the hybrid record system, and the utilization of the K21 Hospital Information Management System. The implementation of retention schedules and the procedures for the disposal of records and disaster preparedness also add to the robustness of the information management system of the hospital. Thus, the case of Columbia Asia Hospital Klang illustrates the importance of a well-managed health information system. This ensures the efficiency of the hospital operations. It also ensures that the hospital is compliant with the regulation and standards set for the healthcare industry. Moreover, the integration of information technology ensures that the hospital is able to respond to the changing demands of the healthcare industry. This case study also illustrates that information management is not only a regulatory requirement, but also an important component for the delivery of quality healthcare and the maintenance of public confidence in private healthcare institutions.